Good morning, and yours truly, Dolphy Alexander Gilpin, returned, beaming from a 1524 Lavista Drive, Decatur, Georgia, United States of America. And we are continuing now with our medical malignancy, and specifically now in obstetric and gynecology from that section. And we were on endometriosis. And for this session, we'll focus now on the treatment and also some of the symptoms. But briefly now, we have drawn here now a simple diagram. Here we had now the fallopian tube, we had uterine cavity, the uterus, and the cervix, and the vagina right here. And we say now that endometrial implants leading to endometriosis were found outside the uterus, outside the lining of the womb. And here they are, and some of them are found on the ovaries here, endometrial implants. This is the ovary. This is now the tube, the broad ligament, ovary, fallopian tube, and all these now are endometrial implants leading to the malignancy, endometriosis. Now, some of the symptoms we could have for the ladies now encountering this problem: allergies, asthma, difficulty in breathing, chemical sensitivities, autoimmune disease, chronic fatigue syndrome, fibromyalgia, breast cancer, ovarian cancer. Well, this was a personal regime I had developed back there 10 years ago when I was actively in medical research. But since then, it has become dormant due to an injury. But nevertheless, this was the Amz5x12 matrix in its implicit pharmacochemical application mode. That was extensively used throughout my regime in research. But like I said, for the past 10 years, I have not entered into medical research due to injury. So here we are now. Medroxyprogesterone, it's one of the drugs pharmacochemical use. Norhisterone was also used in heavy to control the heavy bleeding encountered by women with spotted bleeding and very heavy menstrual bleeding. And I have used the AMZ abbreviation NHE for it. Some Punctel, mefenamic acid, was used to help to control the pain. And Laproscopy and ultrasound were used to help to make the diagnosis. Or microscope was used under microbiology and histology to analyze the tissues. And epidemiology, well, that gives us some of the statistics. But like we said now, that 3 to 10% of the reproductive female encounter this condition of endometriosis, and that 50% of them encounter fertility problems. That is, the problems with going through full ovulation process and to be conceived with child. So that's just an outlook on what's happening here. And briefly, I've said that just assign a temporarily, not permanently, some abbreviation in the configuration, 5x12 configuration. MP here for Medroxyprogesterone, NH here for Norhisterone, which was used to control the bleeding, MFA, mefenamic acid, and I've also assigned some digits here random. The decimal points are to be inserted there by the practicing physician. IBU, Ibuprofen, and Acetaminophen, they were used just as placebo because non-steroidal anti-inflammatory drugs were found not to really help most of the people, female, encountering this endometriosis. So hormone replacement therapy, Medroxyprogesterone, Norhisterone, Mefenamic and Ibuprofen, and then Acetaminophen. These are just going back, pharmacochemical, going back 10, 15 years ago, really. And I know for certain that they have developed a more modern pharmacochemicals that can be applied to this malignancy of endometriosis. So once again, we look at the various, the multiple disorders and symptoms that encounter we have with endometriosis. We have allergies, asthma, chemical sensitivities, autoimmune disease, chronic fatigue syndrome, fibromyalgia, breast cancer, ovarian cancer, and so on. I note though that this endometriosis can be mimicked by PID, which is pelvic inflammatory disease. Let's just write it here. Pelvic inflammatory disease, PID, and also IBS, which is irritable bowel syndrome. So that the condition now of pelvic inflammatory disease also mimic the condition of endometriosis, and irritable bowel syndrome sometimes also mimic the condition of endometriosis. So that's just a brief look at now the complications encountered by the females with endometriosis, and also a very brief traditional perspective look at some of the pharmacochemicals that were used to treat this process of endometriosis. So as I have stated that random topics will be chosen, no orderly fashion, and they will be chosen from various fields of medicine, and they will be expounded upon. And histology, epidemiology, endocrinology, obstetric and gynecology, hematology, dermatology, otolaryngology, cardiology, endocrinology, and also for the medical fields. Random choice will be made. So we're going to take a brief break from this, and we will return with some other malignancies and solutions to the malignancies encountered in the human body.